My name is Dr. D, and I have a special guest with me here for another episode of Conversations with Dr. D. Her name is Janelle Chaperon. Am I saying it right?
Yes.
Okay, perfect. So she's a certified nurse midwife, and I thought that given our conversations about pregnancy during the pandemic, she would provide us with some great insight as a patient and a provider. So Janelle, if you wouldn't mind taking a few minutes to kind of introduce yourself, tell us a little bit about you and what you do, and your how old is your baby now?
She's gonna be 4 months this week coming.
Awesome. So yeah, you had her right in the height of everything. All right, go ahead and tell us a little bit about yourself.
So, like she said, my name is Janelle Chaperon. I'm a certified nurse midwife. I work at St. Barnabas Hospital in the Bronx. I've been working there for 6 years. That's my first midwifery job. I was a nurse, registered nurse before that. I was working in pediatrics. So I've never worked LND before until I started working
Oh
actually
wow.
as a nurse. So
Hmm.
I did peds nursing for like 10 years
Hmm.
before going into midwifery.
What made you want to do midwifery after 10 years in pediatrics?
I like the teen pregnancy
Hmm.
because I feel like when people hear teenagers pregnant, the first thing you do is shame them, talk about them, bash them, rather than educating them and helping prevent doing this whole cycle over again.
Hmm.
So that was one of the main things because especially in my church, I work with a lot of kids and you see them. So
Yeah.
that's
Yeah.
that's one of the main things that brought me into it.
Okay. That's awesome. So you said you've been a nurse midwife for about 6 years.
6 years.
Okay. All right. So tell us, what are some of your most memorable experiences as a nurse midwife? Just to kind of get the ice
Patient.
broken a little bit.
The patients. So in the Bronx, I work with a lot of like Hispanics,
Mhm.
Africans, and a lot of like in the lower socioeconomic area.
Mhm.
So it's the patients that come in, the knowledge that you help them get, because a lot of them like they first of all they don't know what a midwife is. They're
Mhm.
just like, oh, I'm here to see a doctor. So when you're like, oh, I'm a midwife, they're like, oh no, I'm not here to have a baby. I'm like, it's not just pregnancy, it's the whole women's care, birth control, regular annual pap smears. So just knowing that you can educate them and show them something a little bit different, take a little bit more time out with them is one of the memorable things about them. And as far as the deliveries as well,
Yeah,
each delivery is different. Each
that's
patient is
that's
different.
right.